Lateral projection Danelius-Miller method. Position of patient. Place the patient in a supine position. Position of part. When examining a patient who is thin or who is lying on a soft bed, elevate the pelvis in a firm pillow or folded sheet sufficiently to center the most prominent point of the greater trochanter to the midline of the IR. The support must not extend beyond the lateral surface of the body, otherwise it will interfere with the placement of the IR. When the pelvis is elevated, support the affected limb at hip level on sandbags or firm pillows. Flex the right knee and hip of the unaffected side to elevate the thigh in a vertical position. Rest the unaffected leg on a suitable support that will not interfere with the central raise. Special support devices are available. Adjust the pelvis so that it is not rotated. Unless the contraindicated, grasp the heel and medially rotate the foot and lower limb of the affected side about 15 to 20 degrees. A sandbag must be used to hold the leg and foot in this position, and a small support can be placed under the knee. The manipulation of patient with the unhealed fracture should be performed by a physician. Position of IR. Place the IR in the vertical position with its upper border in the crease above the iliac crest. Angle the lower border away from the body until the IR is exactly parallel with the long axis of the femoral neck. Support the IR in this position with the sandbags or a vertical IR holder. These are the preferred methods. Alternatively, the patient may support the IR with the hand. Be careful to position the grid so that the lead strips are in the horizontal position. Oblique projectionHshieh method. Raw position. Position of patient. Place the patient with a suspected posterior hip dislocation in the semi-prone position and center the affected hip to the midline of the radiographic table. Position of part. Elevate the unaffected side approximately to 40 to 45 degrees and have the patient support the body on the flexed knee and forearm of the elevated side. Adjust the position of the body to place the posterior surface of the affected iliac bone over the midline of the grid. With the IR in the bucket tray, adjust its position so that the center of the IR will lie at the level of the superior border of the greater trochanter. Axiolateral projection Danelius-Miller method. Position of